Hello, and welcome back to the American Heart Association's Red Chair series, sponsored by Rochester Regional Health. In our previous episodes, we've been talking about a few aspects of health equity. Today, we're going to discuss one you may not think of, geography, and how it can play a role in your heart health. Today, I'm joined by Dr. Timothy Malins, Director of Eastern Region Cardiac Services with Rochester Regional Health. Dr. Malins, I know this is something you're passionate about. Why is cardiology important in a more rural setting?
It's a great question. And first, thanks for having me. I really appreciate it because this is, as you pointed out, something that I'm very passionate about. If you think of living close to a big hospital that has everything that we need, something happens to you, you're going to call 911 and you'll end up at the hospital very quickly. We're a very diverse geographic area here, and we have a huge population that lives a long way from what we call tertiary care systems and are dependent upon more rural hospitals. What I'm trying to really provide is services that you can get locally, but also realize that outcomes in more rural areas are not as good as if you're in a more urban area because your time to get acute care is delayed just by geography. And so we have a saying in cardiology that time is myocardium, or time is heart muscle when it comes to an acute heart attack. And all that means is if you have an acute heart attack, the longer it takes for you to get and open up that artery, it is doing more and more damage. So that's where it can kind of be a more risk factor for coronary artery disease. And also, we historically have not had specialty care out in the more rural areas. And so when you can provide that, we have more continuity of care, better patient satisfaction, better outcomes, and really provide high value care. So again, I'm very passionate about it, and us providing care locally also has economic impacts. Not only economic impacts for the local community that you're building up care and providing jobs, but economic impacts for the patients. They're not having to spend the gas money to travel 20, 30, 40 miles each way to get it. We want to provide it locally.
Can you tell me about the Mission Lifeline project you worked on and how that reaches out into rural areas?
I really worked hard on this when I was president with the American Heart Association and in collaboration with not only the American Heart Association, but all of our local systems and rural hospitals. And what this was a project to look at exactly that scenario where somebody has an acute heart attack. And what is the timing? How should these people go to a local hospital and get a medication to bust the clot, which is not as good as going and directly doing it? And so what we did is, which is only done in the Rochester area, so what we did is we took data from all of the hospitals, looked at the time it took for people to either go directly by ambulance or go to one of the local hospitals, and then took the data and implemented processes at the local hospitals. And now we have a protocol on what to do to these people who are in these outlying areas. And I would say that there was a lot of philanthropic support, both from American Heart Association, but also from the Greater Rochester Health Foundation.
So if you are one of those people in the outlying areas, what would you recommend they do if they feel like they're in a health emergency?
So obviously, the first thing that you want to do if you think you're having a heart attack, or you're going to call 911. And then with the work that we did with Mission Lifeline, it almost will work itself out because the ambulance and EMS crew were all a part of this process as well. And so based upon geography, miles, they may take you to a local hospital wherever you are, and we would then do the clot buster that we talked about. Or because of the protocols, they would say, hey, we're only this amount of time. We're going to go directly to the city, and we're going to directly open up that artery with a stent, which may not have happened otherwise before when people were taken to a local hospital, but it was too much time.
Calling 911 is your best bet.
Always.
Thank you so much, and thank you for joining the Red Chair series.